This is the second session of our three-part series on perspectives on hoarding, presented by the Hoarding Connection of Cuyahoga County. The conference series is presented with funding from the ADAMHS Board of Cuyahoga County with support from Benjamin Rose Institute on Aging. And I do want to let you know we had planned to have a panel of consumers to share their experiences with hoarding in the family. Unfortunately, we were not able to get any consumers to commit to participating in the panel. All of our invitations were declined, but Dr. Frost does have some videos sharing consumer experiences in his presentation. So you will still be able to see real life examples of hoarding in the family. And now I'll introduce Dr. Frost. Dr. Randy O. Frost is the Harold and Elsa Cipolla Israel Professor of Psychology at Smith College. He is an internationally recognized expert on obsessive compulsive disorder and hoarding disorder and has published more than 180 scientific books, articles, and book chapters on these topics. He serves on the Scientific Advisory Board of the International OCD Foundation, and with Dr. Gail Skekety, he co-edits the Hoarding Center on the OICDF website. He has co-authored several books on hoarding, including Buried in Treasures, Help for Compulsive Hoarding, Compulsive Acquiring, Saving, and Hoarding. That Buried in Treasures have received the Self-Help Book of Merit Award from the Association for Behavioral and Cognitive Therapy, and is the backbone of the Buried in Treasures workshops that have shown significant improvements in hoarding behaviors and are running in locations around the world, including Cuyahoga County here in Ohio. His newest work, the Oxford Handbook of Hoarding and Acquiring, was published in 2014. Dr. Frost was awarded a Lifetime Achievement Award for excellence in innovation, treatment, and research in the field of hoarding and cluttering by the Mental Health Association of San Francisco, as well as a Career Achievement Award from the International OCD Foundation for his work on hoarding. And now I will turn this over to Dr. Frost for Hoarding is a Family Affair.
Thank you, Jean, and thank you all for being here this afternoon. Let me take just a moment and share my screen. Okay. Okay, today we're going to talk about hoarding and hoarding disorder and the family. And I want to touch on 4 different ways in which the family is involved in hoarding cases. And the first has to do with how hoarding disorder affects family members. For a long time in the research on hoarding, up until just a few years ago, this was a really neglected area. People who had family members who suffered from hoarding disorder suffered greatly, and in many cases that suffering was not well recognized by the community around them or by the psychiatric community. So and that's been changing in the last few years. So I want to talk a little bit about some of the work that's going on now related to how this behavior affects family members and various types of family members. A second, sort of following from that, is the development of some resources to help family members in a number of contexts. Now, this is a very new area, so there's not a lot here, but there's a little bit for us to talk about. The third topic for today is what are the family factors that influence the development of hoarding disorder? We know that hoarding develops in a family context. And so there is a little bit of growing evidence now on what kinds of things are associated with the development of hoarding disorder. And so we'll spend a little bit of time on that. And then finally, we want to talk a little bit about the role that family members can play in treatment. So those are the 4 areas we're going to talk about. But first, I want to get to the basics and talk about what is hoarding. And I'm going to just run quickly through the diagnostic criteria for hoarding. These are the criteria that were set out in 2013 by the American Psychiatric Association in the DSM-5. And there are 4 inclusion criteria for hoarding disorder. The first one is the persistent difficulty discarding or parting with possessions regardless of their actual value. Two things are important in this criteria. First is that it's not just throwing things away. It's not just throwing trash away, but parting with any possession that isn't needed and is in the way. And the second feature has to do with the value of the object. Initially, many people thought that hoarding disorder was limited to the inability to throw away worthless and worn out items. This is a part of the diagnostic criteria for the obsessive compulsive personality disorder, if you're familiar with that section of the DSM. And so many people assumed that that was what characterized hoarding. But what we know from the majority of the work that's been done since then is that hoarding, the objects that are hoarded, many of them may have little value, but many of them can have great value. We've seen lots of cases where people's homes are filled with items that are brand new and never used. And they come into the home and they simply sit for decades at a time. So it is not the value of the possession that really determines this definition of hoarding, but the volume of possessions, the difficulty discarding. The second criteria here is that this difficulty is due to a perceived need to save the items and distress associated with discarding them. This separates it from many other disorders where there might be a buildup of clutter in one's home that's really a function of a different disorder, such as depression or something of the sort, schizophrenia perhaps, where items build up and because of either motivational issues or cognitive issues, the person is unable to organize and discard them. So these are the first two and the main inclusion criteria for hoarding disorder. The third inclusion criteria is that the symptoms of hoarding disorder result in the accumulation of possessions that congest and clutter active living areas and substantially compromise their intended use. If those living areas are uncluttered, it's only because of the interventions of third parties, such as family members, cleaners, or authorities. A couple of important things about this criteria. The focus here is on active living areas of the home. So clutter in the basement, clutter in the garage, clutter in the attic really would not qualify for hoarding disorder if that's the only areas of the home that were substantially cluttered. Secondly, the clutter has to be serious enough that it compromises the use of that room. And so there are a number of ways in which we get at that, but basically the clutter has to be of a sufficient volume that it gets in the way of the person engage in the regular activities of daily living. And then finally, there is the possibility that people with hoarding disorder might not have cluttered spaces if other people take responsibility for those living spaces, such as family members, cleaners, or authorities. If the authorities have been in and cleared out a home, it doesn't mean the person doesn't have the disorder anymore. It's that the clutter has been controlled by an outside party. The fourth inclusion criteria is that the hoarding causes clinically significant distress or impairment in a number of areas of functioning, social, occupation, or other important areas, including maintaining a safe environment for self and others. And that's perhaps the first starting point, is to evaluate whether the environment is safe. So those are the four inclusion criteria. There are a couple of exclusion criteria. That means that if these conditions exist, then the diagnosis would not be made. So if the hoarding is attributable to another medical condition, then we would not give the diagnosis of hoarding disorder. And these might include things like brain injury. There are certain case studies of particular kinds of brain injury that have produced hoarding behavior. Cerebrovascular disease. Prader-Willi syndrome is a genetic syndrome that is sometimes associated with hoarding behaviors. The final exclusion criteria is that the hoarding is not better accounted for by symptoms of another DSM-5 disorder, meaning another mental disorder. So we sometimes see hoarding as a function of obsessions in obsessive compulsive disorder. Sometimes we see it in the form of decreased energy in major depressive disorder or delusions in schizophrenia or other psychotic disorders. Also in dementia, the cognitive deficits associated with dementia sometimes can produce hoarding-like behaviors or hoarding-like residences. And another overlap here is with autism spectrum disorder. The restricted interest in autism spectrum disorder sometimes lead people to collect and store items that have a particular theme associated with them. One of the ways in which that differs from hoarding disorder, we don't see that restriction in the themes of the collected materials. So those are the diagnostic criteria. There are also two specifiers. And the first specifier is with excessive acquisition. If the symptoms are accompanied by excessive collecting or buying or stealing of items that are not needed or for which there is no available space. Now, the important feature here is that from the start, we've known that excessive acquisition is a very common occurrence in people with hoarding disorder. In fact, our research suggests that an overwhelming majority of people engage in excessive acquisition. There's some findings from one of our studies on excessive acquisition. And this is from a large sample of somewhere in the neighborhood of 400 folks with serious hoarding symptoms. And you can see nearly 80% of them have a problem with excessive buying of material. Over 60% excessively collect free things, and nearly 60% do both of these things. And if you add it all up, it's about 90 to 95% of people with hoarding disorder engage in excessive acquisition. Now, it's a funny occurrence in the literature here, where the question is, why would not excessive acquisition be a diagnostic criteria for hoarding? And the feeling was in the subcommittee putting together the diagnostic criteria is that there is at least some evidence that not everyone with hoarding disorder engages in excessive acquisition. Although that's in some ways it's a question that we're waiting to answer a little bit, because we have some problems with assessing excessive acquisition. First is the ability to recognize it. And people with hoarding disorder sometimes don't recognize the fact that they're acquiring things excessively. And secondly, sometimes people use avoidance behavior to limit their excessive acquisition. For instance, in one of our studies, another one with a very large sample, what we found was that about 60% engaged in excessive acquisition. Another 28% reported that they did not currently acquire excessively, but had done so in the past. And now what they were doing was not acquiring excessively because they were avoiding the areas in their life where they had trouble controlling the urge to acquire. And then an additional 4% reported neither current or past acquiring, but did report avoiding places in order to keep themselves from acquiring things. So in total, about 92% of these cases appear to have some difficulty with excessive acquisition. And of course, the difficulty with avoiding places so that you don't acquire is difficult because our culture is one where it's nearly impossible to avoid the cues to acquire. So as a long-term strategy, it doesn't work well to control acquisition. The second specifier has to do with insight. And we're going to come back to insight a little bit later as well, but let me just run through it here. This way of assessing insight is common across all the anxiety disorders and obsessive compulsive disorders in DSM-5. The first category is people who have good or fair insight, meaning that in this context, they recognize that the hoarding related beliefs and behaviors, those pertaining to difficulty discarding items, clutter, or excessive acquisition, are problematic. Poor insight, the person is mostly convinced that hoarding-related beliefs and behaviors are not problematic, despite evidence to the contrary. And absent insight, where the person is completely convinced that the hoarding-related beliefs and behaviors are not problematic, despite evidence to the contrary. Now, this is really an important feature when it comes to family, and we're going to come back to it and talk a little bit about the importance of insight and the way in which it affects the family of people with hoarding disorder. All right, so that's the basics for hoarding. Now let's get to the questions we want to ask. First of all, how does hoarding affect family members? Well, the first thing I want to do is show you the kinds of comments, the kinds of complaints we get from family members about their hoarding loved one. And one of the most troubling ones and saddest one really is this notion that this person cares more about her things than she does me. That's something that we've heard over and over again by children of people with hoarding disorder, especially after they've grown up, looking back over their life. She stole my childhood. The kinds of behaviors, the kinds of things that we'll talk about in just a minute that happen to kids whose parents have hoarding disorder, really leaves them with a pretty negative view of their experiences in childhood. Another feature we see frequently is what a phenomenon we've come to call doorbell dread. And that occurs in a family with a hoarding problem when anyone unexpected comes to the door. Once the doorbell rings, panic ensues, and the family members are running around trying like mad to somehow cover up the view that the person would get if the door were open to them. And so it's a pretty common occurrence, and one that in some ways is associated with the stigma that comes along with hoarding. And that stigma comes from various sources, not the least of which are the TV shows on hoarding behavior. But that stigma extends not just to the person with the hoarding problem, but also to their family members. The sense in which, another one of the common complaints is the sense in which their lives were chaotic as children, that the things did not get done. The organization of the life was so tentative that many things fell through the cracks. It's difficult to find things. One case, woman described to me a phenomena where the family was Catholic, and they always referred to Saint Anthony when they were looking for something, because Saint Anthony was the patron saint of lost things. And they would chant, Saint Anthony, come on down. Something's lost that can't be found. And so the whole family would be searching for some item in the chaos, and the chant would start, and the chant would get faster and faster and faster. And so it became a real chaotic scene, and a really powerful scene from this woman's childhood that she remembered. The other common complaint we get is from family members is a lack of information about hoarding. What is it? Where does it come from? Who gets affected by it, and so forth. Just a complete lack of information, especially early on in this process. I frequently talk to people who described their childhood, either people with hoarding disorder or family members of people with hoarding disorder, who said, we didn't know what it was. We didn't have a name for it. And they were surprised to learn that there is a name for it and that there are people studying it. So this lack of information still exists today. So let's turn to the psychological and emotional reactions of people with people who have family members with hoarding disorder. These are the kinds of emotions. This is from a study done in Australia, looking at the psychological and emotional reactions of family members of people with hoarding disorder. And these are the reactions that occurred most frequently in their descriptions of their experiences with their loved one. Anger, sadness, helplessness, frustration, resentment, guilt, and embarrassment. These were These were the most frequent terms applied across the board for family members with this problem. And then let's turn to some more quantitative data. These are some data from a study we did fairly early on family burden and the effect of hoarding disorder on the children of people with hoarding problems. Now, in the study, we looked at these data in a number of different ways. First of all, did you grow up in a home that was cluttered or not? And there are a number of people who have family members who develop cluttering problems after they left home. So we really wanted to see what was the effect of living in a cluttered home at various times in life. And one of the most telling was the comparison of those people for whom the clutter in their home developed before the age of 10 versus after the age of 10. Now keep in mind, all of the people in this study, both clutter before 10 and clutter after 10, grew up with parents who had hoarding problems and homes that were heavily cluttered. But the clutter after 10 group, that clutter didn't really begin until after they were 10 years old. So they went through the first 10 years of their life without clutter. And you can see here the striking difference between these two groups. In terms of their ratings of having had a happy childhood, much significantly lower for people for whom the clutter started before the age of 10. Difficulty making friends much harder for people who had clutter before the age of 10. Having people over to the house almost never for people less than 10 years old, compared to people where the clutter started after the age of 10. Arguing with the parents, significantly more conflict, more argument with parents if the clutter happened before the age of 10. Embarrassed by the home, significantly more if the clutter is less than 10 years, clutter occurred less than 10 years old. And a strained relationship with the parents, much worse for people for whom the clutter was bad before the age of 10. Now keep in mind that these are adults looking back at their childhoods and thinking about them and projecting forward. The strained relationship with parents continues on into adulthood. And it's still significantly worse for people for whom the clutter occurred before they were at the age of 10. Other kinds of family burden. First, here, the family burden really has to do with the extent to which the family member's behavior is impaired or changed somehow in a negative way by the hoarding behavior. And the first way that happens is that they modify their leisure activities, sports, hobbies, due to the relative's hoarding behavior. In most cases, that behavior is eliminated or greatly reduced. I modified my social life, not bringing friends home is an example of that due to the relative's hoarding behavior. Missed work or school due to the relative's hoarding, been unable to use rooms in their home or the relative's home due to the clutter, and limited visits to the home of the relative and minimize time spent there or arrange to meet them elsewhere. This typically happens with adult children of people with hoarding disorder who are living apart from their parents. So these are ways in which the family is burdened by the hoarding behavior. Another feature here, and it's one that's critically important, goes back a little bit to what I said earlier about the lack of information about hoarding. One of the ways in which people have discussed this is people with hoarding disorder seem to have difficulty understanding, people who live with folks with hoarding disorder have difficulty making sense of these symptoms. And it's certainly understandable when you see some of the homes that we do that are so full, it really appears as though they are, it doesn't make sense for anyone to live this way. The three basic questions that people talk about. Why do my loved one acquire and save things they don't need? Why don't they realize it's a problem? Coming back to the insight question. And why do they react badly to attempts to help? And those things are critical here. Some of the research that's been done looking at relatives of folks with hoarding is that the most frequent request that people make when they're asking us for something to know something about hoarding disorder is a request for more information. What is it? Why does it happen? And so forth. Very much in line with what I said earlier about people not even having a name for this behavior. So that's an important feature of the disorder. Insight in hoarding. I mentioned earlier, we'd be coming back to that. The insight in hoarding is a really difficult theme to understand. And let me provide you with the data we know first, and then a few complications related to it. We know that in community samples of people with hoarding disorder, now community samples being those samples where the hoarding cases are identified by community agencies, so elder service agencies, health departments, and so forth. And when you look at the case reports of the caseworkers for these organizations, you find that their ratings of insight, much along the lines of the insight specifier in DSM-5, suggests that 41 to 55% of the cases have poor insight. If you look at family samples, that is samples, by this what I mean is samples of family members who report on insight of their loved one, 53% of the time they report poor insight or delusional. But if you look at research samples, that is samples that researchers collect where they seek volunteers to participate in studies, then we see only 15% reporting poor insight. Now, it's hard to understand exactly what the difference is here between these different groups, but we do know that the community samples and family samples may be sampling a different pool of individuals, people who may not ever volunteer to be in a research study. In the research samples, only those people who volunteer to be in a research study on hoarding are included. So there, in some ways, there's certainly maybe a difference in level of insight there. The other feature is that we do know that family members tend to over-exaggerate the poor insight and over-exaggerate the symptoms. Whether community samples do that or not, we don't know, but it may also be a function of our understanding of what we mean by insight. The classical definition of insight has to do with the inability to recognize a disorder. But what's happened here in all of this research on insight is that it's shifted a bit to this idea that the person doesn't realize that these objects that they are keeping are not important to them or not important enough to keep. Now, the difficulty is that definition of insight begins to merge with the basis of the disorder itself. So a lot of the basis of the disorder, and I don't know if you've heard talks on the cognitive behavioral model of hoarding, but it has to do with the meaning of possessions, a different sense of what possessions mean to people. And these can seem like insight, but indeed they're not true insight. They are part of the disorder itself. It's not an inability to recognize the disorder, it's the disorder itself. So that complicates our understanding of what we mean by poor insight. Nevertheless, it is an important variable. And one of the things that has come out in some recent research on family functioning and hoarding disorder is that there are several things that contribute to poor family functioning in hoarding disorder. And the first of those is the severity of the hoarding behavior. And the second is is the level of poor insight. And both of those things contribute to poor family functioning generally. And poor family functioning then relates to the poor relationship, or leads to a very poor parent-offspring relationship. So the general family functioning affects the individual relationship among family members. And those things are driven by these two variables, the hoarding severity and insight. Now, another thing that's quite important in the family functioning with respect to hoarding symptoms is the extent to which family members accommodate symptoms. That is, doing things for the affected person that would otherwise be neglected. So in the context of hoarding, that might be managing their finances, working on their self-care, any kind of change in the behaviors that they have in order to avoid conflict with the individual. And here are some examples of family accommodation symptoms. I avoid discarding my own possessions due to the distress it will cause my relative. I avoid discussing the discarding of items with my relative due to concerns that he or she will become angry or distressed. I throw away belongings in secret to avoid causing my relative irritation or distress. I bring or buy my relative extra unnecessary items because he or she asked me to do so. And I shop on behalf of my relative in an attempt to limit his or her purchases. Now, family accommodation is something we see in other disorders as well, particularly in obsessive compulsive disorder. And it forms the backbone of some of the treatment for obsessive compulsive disorder, as it does with respect to hoarding as well. And we'll talk a little bit about that and talk about that section. So family accommodation, the effect that it has from some research in several different laboratories is that this family accommodation increases carer distress. That is, those people who care for the individual and do things for the individual, and the family members who take care of them, their level of distress goes up with more family accommodation. So the more they accommodate these hoarding behaviors, the more distress they experience. Family accommodation is also associated with impairment in the children of people with hoarding disorder. So the more accommodation we see in the family, the more negative outcomes for the children of people with hoarding disorder. And finally, the more family accommodation we see, the more rejecting attitudes we see on the part of adult children of people with hoarding disorder. So the more family accommodation that occurred during their childhood, the more they are likely to reject and have more hostile feelings toward their hoarding loved one. The patient rejection scale is one of the measures that was used in a couple of our studies that look at the extent to which there is this hostile relationship that develops between a hoarding loved one and a family member. And these are some of the items that are on the scale that people respond to. I wish he or she had never been born. I don't expect much from him or her anymore. I'm getting tired of having to organize my life around him or her. I just don't care what happens to him or her anymore. And I get more irritated with him or her as time goes on. So this is a scale that's used to examine a number of different disorders with respect to the relationship they have with their family members and with their caregivers. And you see some data from an early study we did. The bar in red shows the scores on this patient rejection scale for family members rating their hoarding loved one. And it's compared to other disorders. The blue line, the first one is obsessive compulsive disorder. The next three are all schizophrenia of different sorts. And the last bar being people with schizophrenia who are about to go into the hospital. schizophrenia. So you can see that in terms of family hostility, the level of negative affect and negative feelings toward the hoarding family member is quite high among family members, people with hoarding. And what predicts that rejection or that hostility? There are a couple of things that predict it. First of all, hoarding severity, the severity of the symptoms, lack of insight, which we've talked about already, and also moderate or greater clutter before the age of 10, which we've also talked about. Seems to be a critical age, critical time point for the effect that this has on family members. And finally, the level of squalor in the home is also a predictor of this rejection or hostility. The long-term outcomes for these features associated with hoarding include reductions in self-esteem, high levels of social anxiety that we see in the offspring or the adult children of people with hoarding disorder, worry about developing hoarding disorder themselves, and long-term conflict with their loved one, with their family members. Okay, so at this point, what I'm going to do is I'm going to show you a video. Now, this is sort of an introductory video of a woman named Marnie. And Marnie is a very successful professional, but she is tormented by her hoarding behavior. And what you'll see are clips in her living room. She runs a business out of her living room, so it's not as cluttered as the rest of her house. But she has it's a pretty serious problem on her part. Now, she also has obsessive compulsive disorder, so there's some comorbidity here. But I want to give you a sense of what her life is like and a little bit about how that relates to her family. I'm going to show you a number of clips, but this is the one that sort of introduces her. So we'll see a little bit about who she is to start with.
I am, if you will, real life Hannah Montana. Superstar when I'm teaching, and different life completely when I am not teaching.
I always remember having a messy room. I remember my dad yelling, you know, you girls are living in like you live like pigs. And I remember him trying to help me once clean my room. And this must have been, this is before I was a teenager, and I can still remember, this is so hoarder, but I could still remember I threw out a nightgown that I still resented that I threw out. And I threw out stencils. And it's like I have such a bad memory, but I have such a good memory of everything that I've lost in my entire life. It's really awful. But I just have a thing with things and not losing them and I still, because I'm buried in treasures, I have really feel I was born with this gene, because I always collected things, and I think that there's a sixth sense for hoarders where we do see things more deeply and richly. And so where you might say, oh my God, that's a leaf. I still have a leaf in my house somewhere because it was like so big. It was huge. And I was like, that's gorgeous. That's just gorgeous. And so of course I brought it home. Maybe a normal person, a non-hoarder would go, that's gorgeous, and keep walking or take a picture. But I was like, it's on the ground. It's not, it's not like I was digging in trash, but it was phenomenal that a leaf could be so big. So I took it home. That's how I roll.
Is when I was in elementary school, I remember a woman came to an assembly, and I don't remember what she said, but I do remember that I thought it was an amazing speech amazing talk, and I wanted to remember her, and I wanted to remember the talk. So I went up to her in elementary school, and I remember I could see myself talking to her, and I said, "Can I have something of yours? Like, may I have your earring or something?" And I think it was even a pearl earring. That's what I keep thinking it was. And I don't really remember what she said, but she didn't shame me, but I just think she just must have said, "Sweetheart, that's kind, but you know, I can't give you my earring." And I just, I remember just how I just always thought if I have their thing, a piece of them, an object, then I'll be able to keep the memory in it. So maybe if she gave me her beautiful pearl earring, I could tell you what the talk was about. But I just remember it was super inspirational, and to me, it just was very simplistic. If you give me something of yours that you're wearing, then I'll be able to remember you. My mother had passed, it must be her garbage, and I think, oh, it's pretty, and then I look in it, and I see that there's even some medicine from her, and some other things that I can't identify. Of course, there's a pistachio chip, whatever. It just makes me so sad, and it just, things connect me to people is how I see it. Every time I throw something out like this, it feels like I'm saying goodbye to my mother all over again, and this is so painful. And I wish that, first of all, I wish that I knew what was in there, because I can't identify it, which makes me nuts, and I wish that people had more empathy for me, because I didn't mean to be born like this, and it's really hard. Okay.
So I hope you're able to hear that. I forget to do what I was supposed to do before I started to improve the sound quality, but if not, someone let me know, and I'll sort of back up and do that. There are a couple of things to notice in this this sequence here that'll come up in a minute. And I'm going to show you a number of clips of her that have to do with her relationship with her family. That points out some of the difficulties, some of the difficult struggles. You notice in this piece that she talks about these objects keeping her connected to people. And it is as though she needs some object, a piece of that person in a sense, something that was connected to that person in order to have this sort of connection with them, to have this memory that gets preserved of her relationship with this person. Now keep that in mind, because we'll see that repeated over and over again with her, with the relationship with her family members. And we saw it a little bit here with her mother, that even a trash can that her mother owned was difficult for her to get rid of, simply because it was something that connected her to her mother. And we'll talk a little bit more about that as we go along. Now, the next video I want to show you is one, whoops, sorry, I'm supposed to start.
If you will.
Okay,
Real
this
life Hannah
video that
Montana.
I'm going to show you now is one that will show you a little bit about what her daughter's life was like when she was young. And here her daughter, I think for this episode that she's describing, her daughter was somewhere in the neighborhood of 10 or 11 years old. So let me show you what that was like, by Marnie's description.
The last trip that I took that the hoarding was super bad was to Israel. And I was such a pain in the butt. I mean, beyond. And everybody was getting irritated with me because I'd be in the gift shop buying everything. I had to buy a huge valise to bring everything home. I had to go out and buy one. And not only that, but they charged me $300 extra for bringing that back, and then and then for the weight on that one and the other one, I was going nuts. And I really, I made everyone nuts. Everyone was, you know, my daughter, which just, she's the one that I really feel the most responsible for. And she can say something to me and it will just right in the heart. Is, you know, she was like, Mom, what are you doing? You know, and I'm like, Kennedy, just leave me alone. I was getting something that was just really important, you know, and then we were late to, we were about to like miss the flight because there was, what is it, the like duty free, this and that and this and that, and I was like, oh my God, I didn't get my friends anything, and I was buying up all this chocolate that's like the most amazing, you know, Israeli chocolate, and I had to show my passport, and then I made friends with somebody in the gift shop because we were comparing things and blah 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 blah, and they didn't know where I was. And they knew I was somewhere off in the gift shop, and my daughter was like in tears, Mom, really? I can't believe you did this again. And I was like, I'm sorry. I'm so sorry. I was just like an alcoholic. It won't happen again. It won't happen again. I'm so sorry, you know? And it was shortly after that I really started to change. I just was, you know, I was horrified by my behavior. And yet, it's like, here I am in the bar again. Mm-hmm. You know, how did I get here? I don't know. I saw a sign that said duty free. I'm not even sure what duty free means, but I do know it means that you can pay less for some shit. So I was like, oh my God, everything is very, oh my God. Everything is kind of in a panic attack. If I don't have this, I will die.
So here we see a couple of things, a couple having to do with the phenomenon of hoarding itself, but the critical thing here for our purposes is the relationship with her daughter and what this is like. And you can see this is a repeated pattern of her daughter being exasperated by her mother's behavior. And this was behavior related to acquisition more than anything else, but we also see that difficulty between her and her daughter with respect to the collecting. We'll see another example of something like that a little bit later on. It also points out something that tells us a little bit about why it's so difficult for her to control this behavior. And it's a phenomena that we refer to as negative urgency. This tendency to engage in rash and emotional behavior when the person is distressed or under pressure. And you can see with Marnie here this sense of, if I don't have this, I'll just die. And we see that over and over again with people with hoarding, this pull of being connected to something she's just found and needing to get that. And this notion, the feeling she has is if she doesn't get it, she's going to die. And so we see that feeling, that experience she has over and over again. And you can see how that, in the moment, that overwhelms her relationship with her daughter. And any other moment where that is not so critical, the relationship with her daughter would take precedence over their behavior. But in this context, that urge, that pressure, that negative urgency sort of takes over in that relationship. Okay, so let's now turn our attention to let's turn our attention to resources to help family members. There are a couple of things that have recently developed that are designed to help people who are carers of family members of people with hoarding disorder. And the first of these is a group intervention for carers of people with hoarding disorder, including family members. And there are a couple of, a number of things that are focused on in this treatment. First of all, the focus is on emotional processing. That is, the processing of the way the individuals feel, the way the family members feel about their experience here. And here, this emotion processing, this is a group format, so it's a discussion of one's relationship with their loved one with hoarding, the way it makes you feel, and really an attempt is made here to bring people around to reconsider or to think differently about their emotional responses to their hoarding loved one. The second feature of the intervention is to provide information about hoarding disorder, something we've talked about already, absence of real good knowledge about what this is all about and what it means. The third feature of this group treatment is to provide resources for the person. Where can I go to find help for my hoarding loved one? And then problem-solving skills, coming to a clear understanding of some of the specific problems that come up with hoarding disorder and where you can go to get those problems solved. And then promoting the carer's well-being. Promoting the fact that family members need to make sure they take care of themselves in these contexts. And not just worry about taking care of their hoarding loved one, that taking care of themselves is as important as taking care of the hoarding loved one. And then finally, monitoring progress and troubleshooting to make sure that the person's well-being is taken care of, to make sure that all of these things are running more smoothly. Now, it doesn't necessarily mean that the hoarding behavior is going to change, but the carer's well-being and the carer's mental health is the topic here that is likely to be sustained. And the outcome data from this particular project looks pretty good. There are improvements in people's sense of well-being, and in the extent to which they have positive experiences in caring for their hoarding loved one. Both of those things changed significantly with this treatment in the first study that was done, and there's only one study has been done. Positive experiences during caring, understanding of hoarding behavior increased significantly, and the sense in which this program was helpful was also significant. And so this offers some promise in actually providing something that will be of benefit to the family members of people with hoarding disorder. All right, so let's turn to the third of our questions. What family factors influence the development of hoarding disorder? One of the ones we know about already is that this is a disorder that is partly genetic. And I just want to show you, I'm going to go through a lot of data, but a couple of pieces of data from a family study we did. And we're comparing people with hoarding disorder, people with OCD, and people without either of those disorders. And we're asking them the extent to which they have a parent who has a hoarding problem or any first-degree relative that has a hoarding problem. And you can see the differences in the percentages here, which are significant. So the hoarding sample in blue here, they have a significantly higher percentage of any parent and any first-degree relative with hoarding disorder compared to people with OCD and people with without either of those disorders. And if we look in more detail about whether it's the mother or the father, you can see that there's a slight tendency for this sort of familial influence to focus on the mother. But father, they're both significant. Both father and mother are significantly more likely to have been hoarding than is the case for people with OCD or people without either OCD or hoarding. And you can see for siblings, the effect is not so strong. So there was no significant difference between the groups for either sister or brother. So it's mainly a parental thing. What other things we know about family background that are associated with the development of hoarding? One is accommodation, family accommodation, which we've already talked about. There's some data that growing up in a family with relatively low levels of family warmth contribute to the development of hoarding behavior. Also interpersonal attachment development problems, particularly parental bonding, and some data on other mental health features may be related here. And that is that if a parent is emotionally unavailable to a child, that is associated with a development of mental problems for that person later in life. And so we think that this kind of interpersonal attachment to parents may be an issue in hoarding disorder, the development of hoarding disorder, because the parents, for some reason, are emotionally unavailable. And finally, there's evidence that self-ambivalence, so sort of identity confusion, is associated. And this is something that develops early in life. And again, it might be related to this interpersonal attachment development, but this identity confusion, we think, might be related to the development of hoarding behavior as well. So there are a couple of themes in the attachments to possessions that are family related. And there are two of them that we're going to explore here with Marnie. And the first has to do with opportunities. And these have to do with the connection of possessions with some kind of imagined future for a family member. And the preserving an idealized past really has more to do with an attachment that's associated with preserving something of the relationship between parent and child from an earlier time. So you'll see this, and you'll see somewhat of a repeat of a theme we saw in the introduction to Marnie. This is the first one.
Now, these are books for my daughter that she might like, and she has a hard time picking books, okay? So it has 1, 2, 3, 4 books that I feel I have to put on her desk, because it's like my anxiety's up to about a 7 in that it needs to go on her desk, so she has the opportunity to see these 4 books that she might love and therefore change her world and maybe even inspire her to become a writer. So the deal is, if I don't put this on her desk, in essence, I've stunted her future. I feel like if I don't put this on my daughter's desk, I am a bad mom. And she had an opportunity to be a great writer, and I've blown it. I'm going to rip it up. And my anxiety's about an 8. It doesn't help that my dog is panting next to me. That just is making me more anxious. Okay, so I've ripped it up, and part of me is saying, ooh, I still have the video. I could repeat it. I could watch it and find out what those books are so that I could give them to my daughter so that she can become a great writer. But I want to be different, and I want to live my life, so I'm not going to do that. The OCD newsletter for me is stacked with information. A piece of paper that has something in it that will change my entire life, and that piece of paper is the best opportunity I've ever had, and that opportunity is lost now because I didn't carefully go through it. Maybe this article in it is going to inspire me to write this screenplay, and the screenplay is going to be the best screenplay, and it's going to change my whole world, and I'll go from the smaller type house to a mansion in Bel Air, and it's all because I haven't read this one article. All these wonderful articles for me to read, and then I realized it is all in Spanish, and I don't speak a word of Spanish, and that is for sure what hoarders do. We don't even look to see if it's in English. And that kind of blew me away. 6 months ago, 2 months ago, I would have still kept it because maybe I would have met somebody who spoke Spanish, or my daughter is learning Spanish, and what an experience that would be for her, blah, blah, blah. Goodbye.
So you see here a couple of features about the nature of this connection between family members. It's a much bigger theme than that. It's the theme of opportunity. What are the opportunities that this offers to create a future that's different? And you can see from this clip that that future she's talking about, she wants that future to be available not only to her, but to her daughter. So this family theme, it gets sort of infused with this sense of opportunity and an idealized self, an idealized future. So the next clip that we see is one that has to do with the past. And let me show you this next.
So I know that it would make sense to get rid of this little baby carriage that Kennedy kept for twin dolls, and it's disgusting, and it's got dirt all over it, and it looks, it might even, I don't know, it's all a mess. To me, it's gorgeous and needs to be here, so I remember always how she played with it. And if I give it up, I feel like, I don't know, I feel like I feel so sad, and I feel like I'm losing that time when she used to play with it. Like it gets erased from my memory. In my eyes, it's gold, and everyone else's eyes, it's trash. I feel like in getting rid of this, I am dumping my daughter's childhood. I am no longer going to be able to remember anything about my daughter's childhood. That is my feeling. I know it's not rational, because that's what I'm supposed to ask. Is that rational? No, it's not rational. But the feeling is so strong, I feel like I could just die. And this is all part of, if I'm not feeling anxiety, I'm not changing. So I feel anxiety, and I'm pissed, but I'm gonna do it because I don't want everyone living in my shit anymore. This is so hard. These are my mom's sheets. And, oh my God, she was so unhappy at the end. And to keep these sheets would be, she wouldn't want me to keep these sheets. They smell like her. This is so emotional and so hard for me. So I'm gonna put it down for now, because I do have a task to do. So, so within the next, I would say within the next week, I gotta see, most likely we don't need her sheets, and there's no reason to keep them. I feel like I don't even have thoughts. My head is just like going bzzz. All right.
What are you feeling emotionally?
Emotionally, just sad. It's like I don't even want to deal with the sadness of my mom's sheets. I mean, it's just sad. And so, of course, I want to hold on to the sheets like I'm holding on to mom, because they're her sheets. But I know sheets, I mean, intellectually, sheets are sheets. They have nothing to do with your mother. I have enough stuff of hers that is real, like a note she wrote to me. That's real. Keeping her clutter, she would not want. I don't like letting go of anything that is a symbol of a time period, because then it feels very much like somebody took my time period away. And in getting rid of it, and it's disgusting. I shouldn't even be touching it. But in my world, that's what keeps memories alive. That's what keeps everything almost even like it existed. If it's not there, the time didn't even exist. I had a kid's fit check system. You could see how tiny Kennedy's foot was. And I don't want to let this go, because her foot once fit there. Letting go of a baby, of a little girl, is really, really hard for me. But this is not my little girl. This is a piece of cardboard. Intellectually, this is a piece of cardboard. This, in my heart, is my daughter. So it's a reminder. And I have to learn to do the reminder that I can still, if I choose to, think about how tiny her feet were. And I always keep symbols around so I can remember things. So it's in the trash. Thanks.
So we see here this extension of this feeling about the connection between objects, possessions, and her daughter to cross many different types of objects. It's not as though these are just pictures of her daughter at various times. These are objects that would normally be thrown away in the course of things, but she can't let them go because of this pull, because of this connection. And so the objects themselves could be irrelevant. Whatever they have that's connected with her daughter or with her mother is something that she has trouble parting with. And you can see that intellectually she knows that this is a maladaptive way of operating, but emotionally she can't break that bond. And so she saves these things and has great trouble getting rid of them, and a great deal of distress that she experiences when she does get rid of them. So you can see here the extent to which the symptoms themselves sort of are infused with family-related variables and family-related relationships. And here, despite the fact that you see this intense kind of connection between these objects and her feelings for her daughter, at the same time, these symptoms, the acquiring and the extent to which she spends time with this, saving things, interferes with her relationship with her daughter. And so it's a funny kind of dynamic in the family. Okay, so let's now turn to what role family members can play in the treatment of hoarding disorder. And one of the ways is as motivators, is a program developed by Greg Chase in Illinois to teach family members to be motivators for people with hoarding disorder to work on the problem. So this isn't a treatment for them or a treatment for people with hoarding disorder, but it's a way of teaching them what they can do to motivate their family member to engage with hoarding related treatments. And the first is psychoeducation, much the same way as we do in treatment, where we try to educate people with hoarding disorder and family members about the nature of this problem. And the second is teaching harm reduction. Now, harm reduction I'm going to talk about in a few minutes, so I'm not going to spend a lot of time here, but it's a specific program designed really for family members who have a hoarding loved one who's resistant to treatment. Motivational interviewing, which is an integral part of the harm reduction program. We'll talk about it at that point as well. And accommodation prevention. Now here, the idea is to minimize accommodation of the sort we talked about earlier. And this is based on attempts to minimize accommodation in the treatment of obsessive compulsive disorder. The idea is if you eliminate these accommodating behaviors, you're making the hoarding symptoms more uncomfortable for the person with the hoarding disorder. It's not so comfortable for them to continue with the hoarding symptoms. So that's a part of this process. Okay, now I'm gonna show you a clip from Marnie that has to do with some of the struggles she's had with her family members and the effect that their behavior has on her and her attempts to try to change.
I also want to say that tonight's been hard because, as you know, my husband was pretty tough on me last week. So my confidence went down, and then my dad was kind of tough on me, was tough on me. Confidence went down even more. So I just want to say that, you know, the more support and love that you can give someone when they're going through this, the more gets done, because we feel motivated and excited when other people are loving and noticing the changes, and the opposite also works when people are rough with you, with me, and insulting of where I could be, where they feel I should be. It's a blow, and it really makes me want to dig in my heels and not do anything. And I could see even today going backwards in some areas, couple steps back in some areas that I'd already gone forward, because now I'm doubting myself again in ways that I hadn't for a while. So I just wanted to express that in terms of the people that are helping hoarders, to, you know, maybe even encourage family members to encourage them and find little things that they've done that's better. I know it's hard living with us, but But if we're making the effort, it can give us a lot more steam to battle through this disorder if we're encouraged.
So you can see here how this program to develop family members as motivators might have prevented this kind of reaction on her part, the criticism from family members, which seemed to really set her back. And you can see her mood was much different in describing these events than it has been for other things. Now, I'll also show you the influence here in the next video, the influence of other kinds of family interactions on symptoms. And you'll see something a little more positive.
My biggest motivation really is my daughter. When she said to me, I asked her to give me a letter. I asked her to write me a letter about how the hoarding affects her, and it was very poignant and beautiful. And that really was like, I was carrying it around at the last, what do you call it, convention, OCD conference, and it just was like, this will get me to change. This will get me to change.
So you see here in this slide, Marnie actually encouraged her daughter to write this letter. And in doing so, it helped her to maintain her focus. Now, Marnie has been doing these little videos for me for some time now. And over the course of about 2 years, we've been doing this. She has sent over 200 of these short videos of herself trying to throw something away and describing what it's like for her. And of all the videos she's shot, I think there only once has she decided not to throw something out. And these decisions were pretty hard for her. But the issue is, how does she keep motivated to experience the distress associated with throwing things out? And this is one of the ways she does, by using her daughter and the inspiration from her daughter to try to do that. Now, I mentioned before harm reduction as a program designed for helping family members of people with hoarding problems, where the hoarding loved one is resistant to the idea of treatment. And there are a number of different features of harm reduction. And first is the attempt to enhance willingness to change. And the kinds of things that are associated here are psychoeducation, which, as we talked about already, is very important for family members. Motivational interviewing. And motivational interviewing is a client-centered approach to deal with ambivalence about behavior. And it is a technique that was developed for the treatment of substance abuse, where people often denied a problem and denied wanting help with it. So teaching this motivational interviewing, this ability to talk to someone in a way that is not coercive, and in a way that it moves them further toward the idea of change, is an important piece of this harm reduction approach. Communication training, also the ability to talk to people where there is a disagreement, and in particular, disagreement about the saving of things. And then how to apply appropriate pressures and incentives. And so that's the first step in the harm reduction approach. The second is to assess the harm potential, and that's related to the kinds of assessments that we do about safety and a healthy environment at the beginning of treatment. Building and facilitating a harm reduction team. Now, typically this team is not only the family members, but anyone else in the person's life that may be a useful resource. Religious figures, friends, other relatives, anyone that the person has a healthy and trusting relationship with that can be a part of facilitating this team. And once this is assembled and these things are done, then there's a creation of a harm reduction plan. And here the goal is reducing the potential for harm rather than hoarding treatment. So the idea here is not treating people how to stop acquiring and start discarding, but really to reduce the level of harm associated with behavior. Now that may include rearranging things in the home, making sure that it's a safe environment and so forth. And then finally, implementing and managing the harm reduction plan. So the focus on harm reduction is especially related to family issues. The family members have difficulty confusing character flaws with clinical features. So there's a lot of stereotypes associated with hoarding. Family members believe them to be lazy, and they look at the lack of insight as a flaw rather than as part of the disorder itself. Confusing resistance with limitations. People who can't throw things out are sometimes blamed for just resisting their request rather than the limits that are associated with the disorder. Confusing helping with hindering, and difficulty accepting the limitations and losses. It's really a matter of accepting hoarding as a serious mental disorder, much the same way as we might see with schizophrenia. And the first task is to say, yes, there are limitations in this person's life, there are losses in this person's life, and those losses transfer to family members as well. Now, I want to show you, before we open it up for a little more discussion, I want to show you a video of a family struggle with hoarding that's sort of gone awry. And I want you to think about these 4 characteristics that might describe the relationship. And we'll talk a little bit about this, this set of interactions when we finish. Okay.
This is good. Don't throw that away.
You're not putting anything in here. This is why your head is up.
This is one of those times you just take the whole box.
He's not going to function as a toddler in this house.
She's got to either choose family or garbage.
Now look at this nice table. Least they could do would be to put out the missing leg. Where do you think they put it? Yes! Oh! This is one of those times you just take the whole box because the whole box looks interesting. I'm Bernie, I'm 57 years old, and I don't consider myself to be a hoarder. Not at all. It's called the pool room because there's a beautiful oak pool table in here somewhere. The kids miss it. They would have their buddies come over and play pool. I first started collecting from other people about 35 years ago. My father had a resale shop, so I would go out collecting things with him, and I just have continued. This was my pickup last week, this little table. The perfect little thing to fit right here between the garbage can and the tater bin. I know the family is upset with me. My daughter, Lauren, and her 6-month-old son lives here.
There's not a whole lot of room for him to crawl or any of that stuff. I mean, right now, I put him down on my bedroom floor. That's pretty much the only spot that's open.
My oldest son, Scott, is upset with me.
It's a pillow that's sitting out here. I mean, throw it away. Seeing a house in such a messy state, it hurts. It's an overwhelming, like, oh, Jesus, look at this place. It's not safe. And heaven forbid, if something happened to her because of the junk, I don't think I could ever forgive myself.
He thinks he's trying to help me by telling me, don't do this anymore. There's no place left to put anything. But I know there's still a couple corners in the house that don't have anything in them. Okay, my first interest is my box full of I don't know what it is.
But it's just garbage.
Oh, look at that, a headband. That's good. I'll wash and disinfect that.
So you'll spend time doing this, or you could be cleaning off your
There we go.
table.
Yes. Ooh.
All right, have fun playing with your trash.
Thank you. Oh, look at this. A couple of new cards that have never been used.
We need to really talk about, I mean, it's gotten out of control. Mom's mess is just ridiculous now.
I can't make her do any more than I've already tried to make her do.
Something needs to be done, and something needs to be done really soon.
It's not safe for him here. Maybe I will just have to tell her that if she can't do it, I'll leave, and Tyler will go with me.
She loves him.
Yeah, and she doesn't
dearly.
want to see him go, and I know
So
that.
she's got to either choose family or garbage.
We need to find the tax stuff.
You're talking about the stuff that was sitting on the desk.
My desk stuff, yes. There was one big brown envelope, had taxes written on it. Ooh,
Have you gone through anything else in here?
there is nothing else to go
The
through
desk
in here.
drawer, the china cabinet drawer?
No, there'd be no reason for it to be in there. It was in a perfectly good box, in a perfectly good envelope, right on top of my desk. Nobody had any business messing with it.
If it wasn't like this in the first place, I wouldn't have had to clean up the desk. That's the
No.
bottom line. Yes.
It's not the mess, it's the...
Mom, it's mess.
No, it's not the mess.
Mom, I'm telling you now, if something doesn't change, I will leave. He's not gonna function as a toddler in this house.
This we have control over.
Well, unfortunately, we have different attitudes about it, so... It started out as a fun thing, you know, collecting roadside, curbside stuff, you know, treasures. Most everything I considered a treasure. Wow. I really got some work to do ahead of me. It's just like a real disaster to me. There's a lot of disgust for my lack of being able to get anything done. I guess I just didn't know how much this affected how many people. I guess it's getting the best of me. I didn't really realize how bad it was.
Hello, are you over there somewhere?
I'm here.
How are you feeling?
All right.
I'm not here to argue. I'm just here to help, try to figure out a game plan for some stuff. Maybe an hour a day or something working on the pool room.
That'd probably be a good idea. A couple hours a day.
I know it's baby steps. We're not going to do this in one day. Making a little progress is all that I want to see done.
I could go in there now and start sifting through.
Well, then let me start just grabbing boxes and we'll go from there. Wow. Looking at it from this perspective, you have quite a tall task ahead.
This is the Cannonball Run. Burt Reynolds, Farrah
One
Fawcett.
at a time, each individual thing. There's 1,000,005 things in there, and she's going through each individual thing.
You see how full my garbage can's getting? Oh, underwear. Scott will be here anytime. I've been up all night going through things, trying to pack up boxes.
If we are physically taking stuff out of the house today to Goodwill, I feel that it's going to be some legitimate progress. Wow. Have we made some progress at all?
Yeah,
All right, I'm going to start loading stuff.
this one's a keep.
See, she packs this in here. So you realize that I'm pulling stuff out of the car to put in here while I'm putting other stuff back in there. All this stuff can go.
No, it can't all go.
It can all go. That's why you have a problem. Because you think that some of this is worth keeping, and it's not.
Just because it doesn't have any interest for you.
No, it has no interest for you. This is why your head is up. Because you think it serves a purpose, and it doesn't.
Oh, I see a roll of stamps. That's a good thing.
And listen to her. She's in there talking to boxes of garbage.
Well, they don't talk back at me like you do.
They don't hold you accountable. Let's go.
Going to Goodwill. Off we go. This is my absolute most favorite street, right here, this stretch. Oh, there's the truck. Let's go beat the truck. Yes. What is that blue thing? Is that a jacket or a blanket?
Go.
Ooh, I will bet that black rug is a real nice black rug, and I'll bet both of these
come
lamps.
on. We have to go.
Watch how fast I can move.
You're not putting anything in here.
What do you think I stopped for, my health?
No. No, just leave them. I'm serious. I don't care.
I'm serious.
Let go.
Stop it.
No, I'm not letting you pick anything else up. I'm sorry.
Stop it.
No,
I want these two
I'm
lamps.
not. I don't give a If we get these, we're taking them right to Goodwill.
If they're no good and don't work when we get home, I'll take them right to the garbage.
No.
Well, I'm not going until I get the lamp.
No, I don't give a I'll break them.
Don't.
They're gonna go. They're gonna go in the garbage.
Scott, you're gonna really, really ruin this whole thing right now, Scott. I'm not enjoying this at all, Scott.
I don't care. You are not picking up any more trash. That's the bottom line. Go ahead. That's how up she is.
He can walk his stubborn, ignorant home. How about that? He thinks I'm stopping for him, and I'm not.
She's so tremendously in the head that she's attached to this stupid. She's got such a problem. I can't handle it anymore.
He really pushed me too far with that one. Really, really shouldn't have done that. I'm really upset past the point of fixing it. I just enjoy it. It's the only thing I do for fun, and I just probably will never stop.
So you see here a pretty dramatic family interaction pattern. It's quite surprising that they actually got this filmed. But it sort of points out the various ways in which the interaction pattern is going wrong in this family. Confusing character flaws with clinical features. In Scott's mind, she doesn't recognize that the true value of these things. And you can see that in the nature of the different ways in which they characterize things. Scott characterizes her things as trash, and she really looks on them as treasures and interesting things and things that keep her sort of motivated in life. He confuses her resistance to doing anything about it with limitation, that she really is limited right now because of this disorder and her ability to get rid of things. And he views that resistance in a very negative way. And he believes he's helping her by collecting things and throwing them out. And he believed that he was helping her when he got out and broke the lamp so that she couldn't take them home. And it's unlikely, although we don't get a clear sense, but it's unlikely that he's accepting any of the limitations and losses that come with this disorder. So it's an interesting piece because you can pick out different features along the way. You can pick out the positive attraction to the new possessions that Bernie displayed. This excitement at discovering things, the opportunity of things, the opportunity for a new identity. She has a favorite street for picking. These are negative motivational pressures against getting better, against getting rid of the hoarding problem. So that positive attraction to the possessions. There were also some negative interactions with Scott that were negative motivational pressures. And part of it is the language that he used and the attitude that he displayed toward her, that talking about how screwed up she was in the head and talking about her talking to garbage and really denigrating her view of these possessions. And one of the things we know about the treatment of hoarding is that we really have to begin at the same point as the client and understand the attachment they have to possessions in the same way and value that attachment, and then try in an attempt to bring it in line with what will lead to a more adaptive lifestyle. There are also some critical moments here in this process, points of possible engagement. And if Scott or Scott's sister had some kind of training in being a motivator for people with hoarding disorder, they might have been able to pick out those moments. When she talked about the pool room, that this was a pool room, if we could have gotten her to elaborate on that pool room and what happened in the pool room and what it was like when it was clear and so forth, that would be a motivating discussion for her. The fact that her father had a retail shop and used to go out with him, the meaning that had for her and the relationship that has to her current collecting would have been a useful family discussion to have to get the topic opened up. Then the beginning of the day when they agreed to work, they were both calm and patient and encouraging to begin with. But the problem was that Scott could not tolerate her pace, her slow pace. And so he began this sort of hypercritical approach to trying to motivate her to do something. Now in all of this, it appears as though Scott is trying to motivate her to do something, but he's doing it in just the opposite way that would be effective. So he's being hypercritical and high pressured in trying to get her to change and doing it using sort of negative motivational strategies rather than taking a look at it from her perspective. Okay, so let me stop there and thank you for your attention to all of this. I hope you've enjoyed it, and let's open it up for questions.
Okay, well, that was very interesting, very intense. So Scott Denver Sackett says, she had so much excitement and joy when finding that pile of trash with the carpet and lamps. You could see her light up. She had so much pleasure that the clip was excellent. Okay. Mm-hmm.
Yeah, you can really see the meaning those possessions had for her and the joy they gave her. And it's one of the issues that comes up in treatment is how can we take that away from someone? And it's something that in order for us to really change that behavior, we've got to help her realign what things are pleasurable for her. And there may be some way of realigning that pleasure in possessions and still allow her to maintain a home that's more functional.
Mm-hmm. So his other question was, how do you combat that? What type of interventions would you use with that?
For this family,
Mm-hmm.
the first thing is, if you think about the section we talked about, Greg Chase's program on family as motivators, one of the things is knowledge about hoarding. And it's clear that Scott really doesn't understand what's happening with his mom. He doesn't understand the nature of this as a problem, as a mental disorder that she can't control. And so that understanding is the first step for him. And then getting him to think about how to approach her from more of a motivational interviewing strategy. So instead of criticizing her for this behavior, to get involved with her in evaluating these objects, to help her process these objects, to make it go more smoothly, because she, and to provide a sense of encouragement. She said in this clip that she was up all night working, and his response was basically to criticize her for not being able to work more quickly. And yet she was up all night. Who would expect someone to be up all night and continue working on this? So his expectations for her are out of line with where she's at right now and what she's able to do.
Okay. What happens to hoarders without a support system? That's Susan Fine's question.
One of the things we know about hoarding is that when someone with a hoarding problem lives alone and no one visits them, the clutter gets worse. And so what we do is we encourage family members or anyone associated with the person to visit and not talk about the hoarding at all, but just visit. Because if someone's coming to the home to visit, the person will make efforts to try to straighten up and clean up someone. So someone who's without a support person, they're really in need of someone to be able to help. Now, there are many times when resources like treatment resources or agency resources for helping folks with these problems can send someone in. We have been running a program through the clinic here where the therapist sees the hoarding client, and then a student intern goes to their home and works with them. Now, right during the pandemic, that hasn't been possible, but they do it over Zoom, and it turns out in some ways it's almost better to work over Zoom because they can easily get into the home and see what it's like. But it's that human contact in the home where there's ability to see what's going on that's quite useful for folks with hoarding disorder.
So Gail asks, what resources can we provide for family members who are willing to help?
The resources that are available are really up to whatever you can find in the community. Now, this program that Greg Chasen has is one, I think he's got a manual for it. So that's the possibility for agencies to take a look at that and learn more about helping or training family members to be motivators. And that would be a wonderful resource.
Okay. Is there, okay, oh, that's starting to come in. All right, so Dana asks, what do you suggest with adult children concerned about parents' safety, physical, financial, where it appears the parent has poor and or absent insight and delusional beliefs?
Yeah, the best resource for folks like that is this harm reduction approach. There's a great book about this called Digging Out by Michael Tompkins and Tamara Hartle. And it really is the initial laying out of this harm reduction approach. And there's a new work out by Michael Tompkins on harm reduction in severe hoarding cases. And that's a great resource as well, but it requires someone to put together this harm reduction team and to create this harm reduction plan.
Okay. Carmen?
Okay, I'm scrolling up just because we want to make sure there were some other ones further up. So there was a question, curious what your thoughts are on using or referring the Marie Kondo method for cleaning and organizing with those that have more mild symptoms of hoarding.
I certainly think any program that helps people stay motivated is useful, and there are a variety of ways of motivating folks. It is sort of technique based, but really what is necessary for people with hoarding disorder is to get to the point where they are processing the importance of the possessions in the context of their life. What typically happens in hoarding disorder is the stuff comes into the home, it populates the home in a very chaotic and cluttered way, but none of the material gets looked at. There's very little time people with hoarding disorder spend interacting with this stuff that's populated their home. And the first order of business is to get people to start interacting with that material. And that's basically what Marnie is doing with these segments. She's picking things up and she's talking about them. One of the things we found in our research is if people just talk about a possession, they will often make the decision that it doesn't fit within the context of their life at the moment, and they'll let it go. And that's the part of the behavior that most people engage in that is not a behavior that people with hoarding disorder engage in very often.
So there was a question back early on about percentages. Okay, here, what are the percentages of men versus women with hoarding disorder?
From what we can tell, it looks like it's pretty evenly distributed between men and women. What we do think also is that men are less likely to have good insight or good recognition of this as a problem. So that's why in some contexts we don't see that many men. So for instance, in research that comes out of the university, where we get volunteers to participate in this research, the overwhelming majority of people in those studies are women. But when we look at community agencies that identify hoarding behavior in a different way, the percentages are more roughly equal between men and women.
When should a family back out and rely on professional treatment? Does family counseling work?
I think in any case, especially a case of serious hoarding, it's really important to get professional help. Professional help not only for the hoarding loved one, but maybe also for family members to help them manage this situation, because it's pretty difficult. In fact, as we saw in some of the data that I presented, that family relationships are really close to fracturing in many cases, if they haven't already. And once it fractures, then it's much harder to get the person on board with doing something about it. That's when the support system goes away, and then things tend to get worse.
Was the question asked about, are there any medications that help manage symptoms?
There are no placebo-controlled trials of medication, no randomized controlled trials of medication for the treatment of hoarding disorder. There are a couple of open trials, and the ones that look most promising are venlafaxine and Strattera. There is some, and again, the data are preliminary, so they're not things you can really recommend. But if push comes to shove, they might be worth a try.
Okay. How do you help move things along if there's an outside deadline, such as from a landlord or code enforcement?
Well, deadlines from landlords and code enforcement can be motivating. It can be quite helpful to have those. But it requires putting together a program so that you have a sequence of deadlines. To just have one deadline at the end, it's pretty hard to manage. But if you sequence it, if you plan it out and so forth, for instance, it might be that if the deadline is a month away, the first month is to focus on the clearing out the means of egress, so people get in and out of the house. The second week or the third week could be to focus on creating large enough pathways through the home so that emergency personnel can get in. The next week might be related to removing old foodstuffs from the refrigerator, or something like that. So there's a plan and a sequence of things with shorter goals, more easily achieved goals in the short term, with this sort of end product being able to pass an inspection.
Someone wanted to know if there's a link for further viewing of the work of Marnie, the videos you showed.
Actually, Marnie has a Facebook account that she uses to show a number of these videos. It's called Help for Hoarders. So if you go on Facebook and sign on to Help for Hoarders, you'll see more. And she and I are working on maybe trying to put together a sequence of these videos up on the IOCDF website, but that's something to come in the future.
Could one pursue guardianship for their adult parent? Would that be wise?
That sometimes happens in hoarding cases, the most serious hoarding cases where the person that attempts have failed to control these things. In my experience, the guardianship programs, they end up helping in the short run. But the difficulty is that in the long run, it's very difficult to keep the person from acquiring and accumulating things. And what happens with a guardian is they end up having to come back every 6 or 8 months and do some kind of a clean out. And so in the long run, it's not a very cost-effective way. And also in terms of frustration and trauma, when someone's home is cleaned out, someone with a hoarding problem, when someone comes in and cleans out the home, it's a traumatic experience. And it can have some lasting and pretty serious downstream effects on the person's mental health.
Okay. The next one is, it looks like it's a comment/question, and you may have answered it, but I'm going to go ahead and read it. I believe 12-step recovery programs might lend a framework to support hoarders' recovery, especially the higher power concepts, such as with turning over memories for their higher powers care. Any medication too can offer some symptoms of relief. There was a question mark there, and I think you kind of answered it, but I don't know if you want to comment any more on that.
Yeah, it's hard to know. I think, you know, in truth, any system that motivates people to work on this. And the issue is that they have to do the work. And the work is evaluating the importance of these possessions in their life. In truth, it starts off very slowly, but it's really like anything else. You have to practice and get good at doing that kind of evaluation in order to clean the house. And really, when it comes down to it, is what has to happen with folks with this problem for them to get better is that they have to learn to make different decisions about acquiring and saving things. And in order to learn that, they have to practice. And anything that will get them practicing making decisions about acquiring and saving things will be useful.
Okay, and Susan, you might have to chime in here, Susan Epstein. There's, to piggyback on Peggy's questions, I think it was about the landlord and code enforcement, how to interact with person with hoarding disorder as a person working in code enforcement.
I'm just trying to find out, like, how to talk to them, because one of our biggest challenges as code enforcement people is how to, besides that deadline that's looming or us taking them to court, is words or you know, a way to talk to them in a way that they understand that there's this life safety issue in addition to whatever else is going on in their life, so that it registers to them that there's a life safety issue, and we need, from a code enforcement perspective, to get it resolved before enforcement can go away.
Yeah, that's a tough question. And I think that's where motivational interviewing stuff comes in, to be able to talk with someone. And I think in part, the power of motivational interviewing is that it allows you to come up with a way of talking with someone in a respectful way, so that you don't violate their sense of value of these possessions. So, for instance, thinking about this the video with Scott, the language that he used violated her sense of value of these possessions and insulted her. A much better way of interacting with people like this is I think demonstrated by this TV show American Pickers, if you've ever seen it. These guys go in and they can go into someone's home, and you can tell this person may have a hoarding problem, and they appreciate the value this person puts on these objects. And that's the place to start, to show interest in the value they see in this object. What is it about this object? What's it like? What does it do for you? And so forth. And to show a real interest, not only an interest, but an appreciation for their view of the physical world around them. And once you do that, then you're in a position to bring that question, to bring up other questions about how, you know, this is a wonderful piece that you've got here. How does that fit into your life? And how do you take care of that? How would you see using that in the future? What would you want to do with it? And are there ways in which it gets in your way now? And then start getting them to elaborate. So you want them to elaborate the ambivalence that they experience between the positive features of this object and the negative features of saving it. So that's the key in motivational interviewing. We want to heighten the ambivalence. And how do we do that? Well, the first thing to do in doing that is to emphasize the importance of change. Now, we can't just tell people that it's important to change. The best way to do that is to talk with them to create a discrepancy between where they see their life right now and where they want their life to be in the future. And so a good place to start is asking people what they value in life, what they value most in life, and what goals they have, because that will set up this idealized future that they're interested in. This is what I want my life to be like. And then we can start juxtaposing that against what their life is like right now. And the more discrepancy we can create between what their goal is and where their life is now, the more motivated for change they'll be. Now, in conjunction with that, and so this creates a dissonance. If there's something wrong here, this is where I want to be, this is where I am now, there's something wrong, I'm going to do something. It will create change. There's no, something will change if you do that. The problem is, if they don't have any confidence that they can actually change, what will happen is they'll take that goal of what they want to be like in the future and they'll start to shave it away until it matches more what their life is like now. And that's the change they'll make. So the first task is to increase that discrepancy. And we get that by getting them to talk about what they want their world to be like and then talk about what their world is like now. That increases the discrepancy. And now we have to help them develop the confidence that they can actually change. And that means doing the work of going in and working with them on a small scale about being able to separate themselves from some of these possessions and feel good about it. And so that, in sort of in a nutshell, is how to approach that problem. It's not easy.
So we have like 3 more questions left in the chat, and I see we're like 2:59. Or is it okay to ask the remaining questions?
Maybe just one more, because I do have
Okay. Okay. So why does it seem like we have more effective protocol in place for animal hoarding with more swift consequences than someone with children in the environment, like shown in the clip? If the hoarding disorder is not reported or are not in the system, you do not get access to resources. But if you are an animal hoarding, it is a criminal matter.
In animal hoarding, yeah. In animal hoarding, if you think about how these cases are resolved in animal hoarding, in most cases, the animals are removed from the home and the animals are taken care of, but the person is not. And so the person ends up, in many cases, collecting animals again. So I think in most cases, there is a protocol that it has been developed in animal control, but the protocol focuses on the condition of the animals and getting the animals taken care of, and not on the mental health ends of things. And this is one of the, I think, one of the weaknesses in the system so far of our approach to hoarding, is that in animal hoarding, we haven't really found yet a treatment that works the way it does with people with hoarding. We do have treatments that work with people with hoarding disorder. They maybe don't work as well as we'd hope, but they do work. As you can see, Marnie's gotten considerably better over time in her ability to control these things. But in animal hoarding cases, the outcomes are defined differently. And as I said, the outcomes are more in terms of the condition of the animals than the state of the human.
Okay. Jane?
Trying to find my mute button. Hi. Thanks, Randy, for sharing all that great information, and to everybody who has questions and all the good responses to those. I also wanted to thank our attendees for joining us today. Hope you found the presentation useful and informative. Just wanted to do a quick reminder that you will be receiving a follow-up email with a link to the evaluation. Please do complete that by Friday if you can. That both to receive your CEs and to provide us feedback, insights for future programs. And unless somebody else has anything to say, that concludes today's presentation.